it's a weak bladder combined with a weak pelvic floor. What are the risk factors? Again, being female is right up there. Pregnancy, vaginal delivery, hysterectomy, obesity. Obesity increases overactive bladder in the same way that pregnancy does, because when you're heavier, we know that resting intra-abdominal pressure goes up. So it's just like having a baby sit on your bladder. Chronic constipation can do it too, and it's the same mechanism. When I do cystoscopies in the office, I can almost always tell when somebody's constipated because the sigmoid colon is just pressing in the back wall of the bladder. So if they have that force on the bladder, it is going to create a sensation that they have to urinate more often. Neurologic diseases and diabetes, certainly things that we do lifestyle-wise. Caffeine, as I already said, Red Bull stimulates my bladder, so a lot of patients who drink a lot of caffeine are going to go more often. Chocolate is a big stimulant, alcohol, nicotine, urinary tract infections, anxiety. I'll tell you a funny story about a lady that I saw a couple years ago. She's very intelligent. She was she had a master's in education and was, over a school district someplace up north, but was retired and was down here. And I'd been working with her on her overactive bladder for a while. And one day she came in and she says, I'm still getting up 2 times at night. So we went back to the drawing board. We started all over again, went through everything. And the only thing I could identify that was in her risk factors is that she had 2 cups of coffee in the morning. The rest of the day she was fine. She had a piece of chocolate cake and 1 martini before she went to bed every night. So I told her to give those things up for 1 month and come back. So she came back and saw me and she says, "You're right, I'm sleeping through the night, but I'm not giving up my chocolate, my coffee, or my martini." And I said, "Fine, then don't come in and complain to me because you have to pay the piper." Again, this is not hazardous to your health. You just have to make the decision.